In this SETCOM session, we are going to discuss about the embalming procedure in detail. Okay. So, do you all remember what are all the points or what are all the important things we discussed in the last session regarding the embalming topic? So, in this session, I am going to discuss about how the embalming procedure will be done in detail. Okay. First, we'll discuss about the definition of embalming, followed by the types of embalming, which I have already mentioned in the last session, then the procedure of embalming, then the fourth topic is preparation of embalming fluid, and the last topic is gravitational injection, or how we will inject the embalming fluid into the body. So, anybody know the basic definition for embalming? Okay, everybody please write down. Embalming is a process. Embalming is a process to preserve the dead human body. Embalming is a process to preserve the dead human body, to reduce the presence and growth of microorganisms, and also to delay or slow down the natural breakdown of cells and tissues. Should I repeat? Embalming is a process to preserve the dead human body, by treating it chemically, to reduce the presence and growth of microorganisms, and also to delay or slow down the natural breakdown of cells and tissues. Take down second definition. Anatomical embalming. This is second definition. Anatomical embalming is a technique to preserve the dead body as a cadaver for the purpose of dissection and studies. Anatomical embalming is a technique to preserve the dead body as a cadaver for the purpose of dissection or studies. These are the two important definitions for your embalming. If you see the different resource, you will get different definition, but try to stick on for these two definitions. Okay. So, what are the types of embalming we mentioned in the last session? I have mentioned about 4 types of embalming. What are those? The first one is arterial embalming, the second one is cavity embalming, and the third one is hypodermal embalming, fourth one is surface embalming. So, what do you mean by cavity embalming? Arterial embalming, at the end I will discuss in detail. First tell me what is cavity embalming. Remember, there are 4 important cavities present in our body: the cranial cavity, thoracic cavity, abdominal cavity, followed by pelvic cavity. Okay. So, what happens in the cavity embalming is, we will try to remove the fluid out from all the 4 cavities in the first place. Later, we will inject the embalming fluid into these cavities. But what is the major drawback of cavity embalming is, here you can only preserve the cavities and the major organs present in the particular cavity, but not the vessels and nerves. You can't study about the vessels, nerves, capillaries and other lymphatic tissues in the cavity embalming. You can only study about the structure and shape of the cavity, followed by the important organs present in that particular cavity. So, that is the major drawback of your cavity embalming. What do you mean by hypodermal and surface embalming? These two are pretty similar techniques. What do you mean by dermis? Skin, right? So what do you mean by hypodermal embalming? Okay, on the surface level, at the skin level. Okay, any other answers? Hypodermal embalming and surface embalming will majorly done when we are only keeping the body for 3 or 4 days, usually for the purpose of funeral. Okay, in some cases we have seen that we'll preserve the body for 3 to 4 days when we have the visitor from a long distance to come and see the body, or when some celebrities or well-known person in the society die, will keep their bodies for the public appearance, right? So at that time we have to keep the body for only 3 to 4 days. In that cases, we'll use these two techniques, hypodermal embalming and surface embalming. These two are done only at the surface level. We can preserve only the skin part, and we can make sure that the color of the body will not change and the odor will not come. But inside the cells, tissues and also the organs will be degenerating. Okay, this is the purpose of these two embalmings. Okay, and the important one is arterial embalming. So we will discuss in detail about the arterial embalming. What is the very first step in the arterial embalming? Okay, draining of the blood. Any other answers? Okay. After receiving the body, we have to shift the body to the embalming room. In every institute, we will be having separately a room called embalming room, where we have to conduct the whole procedure of embalming. Okay. So once after shifting the embalming body to the embalming room, the persons who are conducting the embalming process have to make sure few certain rules and regulations should be followed. Okay, whoever conducting the embalming, they have to wear this knee level or knee length aprons will come. No, they have to wear those aprons, and no shoes or slippers will be allowed inside the embalming room. You have to wear the particular boots. The boots will be of your knee length, or some mid length boots will come. It will be present or kept in all the institutes or in the embalming rooms. You have to wear those boots only, and must and should double gloves and also caps for your head part. Okay, these are the few basic things a person should follow. Then after receiving the body and shifting it to the embalming room, the first and foremost thing we have to do is wash the whole body. We have to give or wash the whole body thoroughly. Okay. Next, what we have to do? Okay, that's it. So once after washing the body, we have to make sure to close all the cavities present in the person. Okay, it must be your mouth, ear, nose, and even the anal cavity. It should be closed with the help of cotton balls or with the certain amount of cotton. Okay, once after doing this, we have to drain out all the deoxygenated blood. Through which way? We have to remove the deoxygenated blood from the body, right? Which way? From the jugular vein. Last time only I have mentioned. It is present in your neck region. You have to pierce the jugular vein, and we have to drain out all the deoxygenated blood present in the body. Okay, once removing the deoxygenated blood, the next step is to do the incision in your triangular area of neck to find out the carotid artery. Okay, so how the person will find out the carotid artery, how they will do the incision? Okay, remember there is two methods to put incision for your carotid artery while doing the embalming process. If a person is very expert, what they are going to do is they'll just check for the clavicle, and this is sternum bone. You all know, right? This is sternum and this is clavicle. So this point is called as the sternoclavicular joint. Okay, remember this part. Now they are going to put one vertical incision in the upward direction like this. Okay, after giving the vertical incision in the upward direction, they are going to do some blunt dissection. What do you mean by blunt dissection? Blunt dissection is nothing but where the person will carefully push the muscles and also the skin area towards the side, and they will pull out the required structure from the body. Okay, so here they'll put one incision in the vertical direction, they'll push all the muscle and skin area towards the side, and they'll carefully pull out your internal carotid artery. Okay, this is very first method. The another one method is your complete dissection. They will check for this carotid triangle part. Remember, in your neck area we have anterior triangle and posterior triangle. Among these two triangles, again we have some subheadings. In that we will get your carotid triangle in this particular area. So they are going to dissect the entire carotid triangle, and they will take the internal carotid artery outside from this region. These are the two types of dissection they'll conduct during your embalming process. Okay. Once pulling out your internal carotid, they are going to tie it in both the upward direction and downward direction. Between the two ties, they are going to make a small piercing of your internal carotid artery, and what they will insert into the internal carotid artery? Embalming fluid. Okay. Any other answer? First, they are going to insert a small pipe-like structure which is called as catheter into your internal carotid artery. Okay. So, after pulling out the internal carotid artery, they will make a small piercing. For that piercing, they are going to insert a catheter which is around like 7 or 8 centimeter. It is a transparent pipe-like structure, small pipe-like structure. Okay. So now we have to make sure by this time your embalming fluid is ready. Okay. So what is the composition of embalming fluid? What is the composition of embalming fluid? Ethanol, methanol, okay. Eosin, glycerin, formalin, water, okay. Ethanol, okay. Okay. So to embalm one individual body or one dead body, we require 8 liters of embalming fluid. Okay. We require 8 liters of embalming fluid. Please note it down, everybody. Formaldehyde 3 liters. Formaldehyde 3 liters. Water 3 liters. Ethanol, which is also called as spirit, it will be 500 ml. 500 ml. Ethanol is 500 ml. Glycerin is 500 ml. For this mixture, so 3 liter plus 3 liter, it will be 6 liter, and your 500 ml is going to be 1 liter. So total 7 liters. Okay. For this, they are going to add 100 grams of boric acid powder. 100 grams of boric acid powder. Okay. Boric acid, B-O-R-I-C, boric acid powder, 100 grams. If you see in different textbook or in different articles, they have mentioned about different chemicals they have used, but particularly please try to mention these 5 things important. Okay. Apart from this, we will also use eosin. Note it down, eosin. What other chemicals we use? Eucalyptus oil. Eucalyptus oil. Eosin. Eucalyptus oil, cetrimide, C-E-T-R-I-M-I-D-E, cetrimide, C-E-T-R-I-M-I-D-E, cetrimide. Any other chemicals you remember? How much these are? Uh, Eucalyptus and Eosin 25 ml. No, separately. Eosin 25 ml and your one more thing, eucalyptus oil 25 ml. Cetrimide, I'm not sure, maybe like 2% or 3%, like that they'll add. I'll check it and I'll tell you, okay? So these are the components of your embalming fluid. So by the time a person will be pierced with the internal carotid artery, this embalming should be ready in your embalming room, okay? So once the embalming fluid is ready, so in every embalming room we will have embalming machine, okay? So the embalming machine will be placed in the ground. In that there will be a small container. For that container we have to pour this embalming fluid. Once we start the embalming machine, that embalming machine is going to fill up to your embalming bottle. Where we have to place this embalming bottle, it should be placed around 3 to 4 feet above the body. It's just like your IV injection will keep, we'll ask patient to lay down on the bed, then we will put the bottle from that bottle, your IV, whatever the liquid is there, fluid is there, it is going to inject into your body. The same embalming process will also done in the same way. Your body will be placed on the embalming table above 3 or 4 feet. Embalming bottle will be there. That bottle is connected to the embalming machine which is kept on the ground part. Okay, once we start the machine, with some high pressure, the embalming fluid will transfer into the embalming bottle, then from the embalming bottle to the body, to your internal carotid artery. Remember the catheter which I mentioned, first we have to inject into the internal carotid artery. That part, one small part of that catheter will be connected to your embalming bottle. Okay, that's how the embalming fluid will be run inside the body. So when we will get to know that embalming fluid is completely replaced inside your body? What are all the signs and how much time it is going to take for one complete embalming process? And what is the ideal time to conduct the embalming after the death? These all are your viva questions. What is the ideal time to conduct the embalming process after the death of a person? Within 2 hours, okay. Any other answers? 6 to 8 hours, okay. Any other answers? The very fine and most ideal time to conduct the embalming process after the death is within 6 hours. What she said is right. Within 6 hours, we should conduct the embalming process. If it is not possible, at least we should try to collect the body within 24 hours and then conduct the embalming process. Okay. To complete the embalming process, it will take around 3 to 4 hours. Your embalming fluid will replace in your entire body within 3 to 4 hours. Okay. What are all the signs? How we will get to know that embalming process is done? Now we have to stop the machine. How we will get to know that? Okay, if embalming fluid start leaking out from the body, then we will get to know that the fluid has filled up in the body. Okay, right. Any other answers? What your friend said is right. Once the embalming process complete, remember we have connected the catheter into your embalming bottle, right? In that pipe, the embalming fluid will start going in the reverse direction and it will start spilling out. It's just like if you take a glass and start pouring water, at one point the water will start spilling out, right? When the glass is completely filled, it's exactly like that. And remember, I told that we will close the cavities wherever the opening is there, we will close that cavities. So once the embalming is completely done, we can see the embalming fluid coming out from those cavities. We can see your embalming fluid coming out from the mouth area and the ear area and also from the nose area. Okay. And another one sign is, before starting the embalming, your thorax and abdomen cavity will be like little flat. So once the embalming process is done, this thorax and abdomen cavity will look like little bulged areas. Okay. And another one important, very important point is, your vessels will start looking very prominent once the embalming fluid is done. Especially in the upper limb and lower limb areas, all the vessels will start looking very prominent. These are the signs that the embalming process is finished. Okay, this is how you should check your embalming process. So after embalming process, what you are going to do? Now we have realized that embalming process is finished, or your embalming fluid is filled up in the body. What we are going to do next? We are carefully going to remove the catheter from the internal carotid artery. Few times, if we are going to use the body immediately for the dissection process, we are just going to cover the opened area or the dissected area with the help of cotton. If we are not using the body immediately, if we are keeping the body for the further studies, we are going to stitch it again. Okay, whatever the area we have opened here for the dissection, that we are going to stitch it up, and we are going to leave the body there only for the next 72 hours. That means almost for 3 days we are going to leave the body in the embalming room only. After 3 days, your body will be ready for the dissection purpose. Okay, if you are not using it for a dissection purpose, you can take the body and put it in the formalin tank. Again, for how many months we have to change the fluid in formalin tank? For every 3 or 4 months, we have to change the fluid present in your formalin tank to keep the body in the proper way. Okay. So this is all about your embalming process. Any doubts? No doubts? No, with high pressure we are going to yes, we are going to inject the embalming fluid into your body. Okay. Remember the components of embalming fluid. So what is the purpose of using formaldehyde or formalin? Your formaldehyde acts as a antifungal and antibacterial chemical solution. Okay. And it also helps to keep the tissues soft. And water will neutralize the whole embalming fluid solution. Okay. Water is useful in neutralizing the solution. What about the methanol? Ethanol, alcohol, what we have used. What is the purpose of using alcohol? What is the purpose of using alcohol? It acts as a disinfectant. Okay. Glycerin. What is the purpose of using glycerin? Glycerin acts as a moisturizing agent, and it will help to keep the tissues and cells soft, which is very required for dissection. What about the other chemical substances which I have mentioned? What is the purpose of using eucalyptus oil? Your eucalyptus oil will help to prevent the bad odor that comes from the cadaver. Okay, it will try to neutralize the bad odor of your cadaver.
If we have to dissect the body, we need that fluid to be taken out. Or when will we dissect the fluid maybe?
No. Once after finishing the embalming process, we are not going to conduct the dissection immediately. We are going to leave the body for 72 hours as it is. After the 72 hours, we can start with our dissection.
So what about the fluid? Is it get absorbed by the tissues or not? Like what about the fluid? What happens to the fluid? The embalming fluid which we injected in the body. What happens to that? Like, is it still there when we dissect in the body, or it evaporates or something like digestion?
No, that fluid won't be there. Or you are asking whether it will be like in the liquid form when we dissect the body. No, it won't be like that. Your fluid will be completely absorbed by the cells and tissues to keep it moist and in a well condition for our dissection purpose. Your fluid will not present as a liquid inside your body. Okay, that is the reason why we are going to leave it for next 72 hours without any disturbance. Okay. Boric. Boric acid helps to maintain the pH level. Okay, it will helps to maintain the pH level of the body. I mean the tissues of the body. Any other questions about embalming? Cetrimide act as a anti-disinfectant. That also. Cetrimide is a white color chemical solution. It is more like a transparent solution which act as an anti-disinfectant. Okay. Disinfectant. Okay. Disinfectant. Eosin. I didn't say Eosin. Eosin is your coloring agent. It is a dye. Okay. What is the purpose of using Eosin, by the way, if it is a coloring agent or a dye? So your Eosin will help to maintain the natural color of the organs or the tissues of the body, which is very much required for the students to know when they are doing the dissection. Okay, that is the purpose of using Eosin. It is a coloring agent. Any other doubts in embalming? Ethanol. Ethanol, I said no, it is an alcohol which is also known as spirit. It is used, it acts as a disinfectant and also antifungal. Any doubts? No doubts? So is the embalming concept clear for everyone? Sure? Any volunteers? Any volunteers to come and discuss here about the embalming process? Yeah. Middle girl. You and here. Fourth table, second one. Both of you come. We have discussed about the definition, different types of embalming, followed by the rules of embalming room, then the procedure of embalming, embalming fluid, components of embalming fluid. Okay. Bring your notes, you can just read it from the notes. Okay.
Embalming is a process to preserve the dead human body by treating it chemically to preserve the growth of microorganisms and slow down the natural breakdown of cells and tissues.
The reason that I gave two definitions for your embalming is I mentioned the surface embalming and also your hypodermal embalming is done for a funeral purpose and all. So the first definition is suitable for those two embalming. For your arterial embalming, which is also called as your anatomical embalming, the second definition is more suitable. So I have given both the definitions, okay?
Embalming is a process to preserve the dead body as a cadaver for the purpose of dissection and studies for the medical students.
Okay. Can you please discuss the types of embalming? How many types are there?
There are 4 types of embalming processes. The first part is anterior embalming. Second, cavity embalming, in which there are also 4 types, subtypes: cranial and abdominal, thoracic, and surface.
Okay.
The composition of embalming fluid would be formaldehyde, water, ethanol, Glycerin, Boric Acid powder, Eosin, Eucalyptus, cetrimide.
Any other volunteers who can discuss the procedure in detail? You can use your notes and discuss. They'll discuss about the procedure. Just listen to them once, okay?
In the arterial embalming, at first we will wash the body thoroughly and remove the blood from the jugular vein and add the embalming fluid into the body
Through common carotid artery. Through the common carotid artery.
to the carotid artery.
Next.
The ideal time to conduct embalming after death is within 6 hours. Fluid will replace the blood within 2 to 3 hours, and once the process completes, the fluid will come out from the cavity to just post-embalming process.
Once the process completes after 72 hours, it can be used for dissection. And if not used for dissection, it will be stored in formalin.
Okay. So embalming of your dead body or cadaver is a 5 marks question. 5 marks EdCom question. Okay. So any doubts? Is it clear for everyone? No doubts? Sure? Any other points you guys want to add for embalming? No. Once we start injecting the embalming fluid into your carotid artery, it will pass to your arch of aorta, right? From the arch of aorta, we are placing the catheter in the downward direction. Remember this. So once it passes in your carotid artery, it will reach to your arch of aorta. From the arch of aorta, it will circulate in your entire blood, in your entire heart part. From the heart, it will go into the other parts of the body. That's how it is done.
Heart is not there, then how
Heart is not there.
it is going to the heart is donated.
Oh no, that kind of bodies will not be accepted. Where the organ donation is happened, no, not only heart, if there is any other organ is donated in the body, that kind of bodies will not be accepted to conduct the embalming process or for any study process. Natural death body. So do you know any other procedures to preserve the body except the embalming? Do you know any other methods in anatomy? There is few other techniques to preserve the organs or body. It is called as plastination. Heard of it? Plastination, cryopreservatives, and one more thing. Okay, take it as an assignment question. Just find out what are the other techniques to preserve the body or organs. For study purpose. Two things I have already mentioned. One thing is plastination and the another one is cryopreservation. CRYO, cryopreservation. There is one more method. Find out the name and try to know the basic definition for all the three preservative methods. Okay? Any doubts? Okay. Then we will end the class.